Imagine someone sitting across from you suddenly begins sweating, shaking, and speaking strangely. They may look exhausted, confused, or even intoxicated, but their brain could actually be running out of glucose. Within minutes, they may suffer a seizure, lose consciousness, or become unable to protect their own airway. This condition is called hypoglycemia,
Laura, are you
or
all
low
right?
blood sugar.
Can you hear me?
It can become
Something
life-threatening when it is not
not
recognized and
right.
treated quickly. The frightening part is that the first signs can look harmless: hunger, anxiety, tiredness, or a little dizziness. Knowing what happens next and what to do immediately could help you save a life. In this video, you will learn the early and severe warning signs of low blood sugar, why it happens, how to use the 15-15 rule, and what to do if the person becomes unconscious. Stay until the end, because one common mistake could turn a treatable episode into a choking emergency. Glucose is one of the body's main sources of energy, and the brain depends heavily on a continuous supply. For many people with diabetes, a blood glucose reading below 70 milligrams per deciliter, or 3.9 millimoles per liter, is considered low. However, an individual's target range may be different, so personal instructions from their healthcare team should always take priority. Early warning signs often appear when the body releases stress hormones in an attempt to raise blood sugar. The person may suddenly feel hungry, shaky, anxious, weak, or unusually tired. They may begin sweating even though the room is cool. Their heart may beat faster, their skin may become pale, and they may complain of dizziness, tingling lips, nausea, or a sudden headache. These symptoms should never be dismissed in someone at risk of hypoglycemia. As the glucose level continues to fall, the brain may no longer work normally. The person can become irritable, emotional, or unusually aggressive. They may struggle to concentrate, answer simple questions incorrectly, speak unclearly, walk unsteadily, or have blurred vision. This behavior is sometimes mistaken for alcohol intoxication. But if the cause is low blood sugar, delaying treatment allows the situation to become much more dangerous. Severe hypoglycemia can cause extreme weakness, an inability to walk,
Easy now.
seizures,
Back down.
fainting,
I'm
or
just
complete
so
loss of
tired.
consciousness. At this stage, the person may be unable to check their own glucose or treat themselves. A blood glucose level below 54 milligrams per deciliter is generally considered severely low, but symptoms and personal thresholds can vary. Low blood sugar can also happen during sleep. Warning signs may include nightmares, restless sleep, heavy sweating, damp clothing or bedding, and waking with a headache, confusion, or unusual fatigue. A person should not assume that low blood sugar will always wake them. A continuous glucose monitor may provide an alarm, but it does not replace an individual treatment plan. Hypoglycemia is especially common in people who use insulin or certain diabetes medicines. It may happen after taking too much insulin, taking medication at the wrong time, or receiving the usual
Hi, I'm
dose
calling
without
about your
eating the
results.
expected amount of food. Changing medication doses without professional guidance can also make glucose levels unpredictable. Skipping or delaying a meal is another common cause. Unexpected exercise can continue lowering glucose, even after the activity has ended. Alcohol may also interfere with the liver's ability to release stored glucose, especially when consumed without food. Illness, weight changes, kidney problems, and changes in daily routine can also affect how the body responds to diabetes medication. If the person is
please remain
awake,
seated.
responsive, and able to swallow safely, check
just
their
gonna
blood
grab this.
glucose if a meter or continuous
ensure your
glucose
hands are
monitor is
clean.
available.
Open a fresh
But do
test
not
strip
allow
from the
testing
foil.
to create a
Insert
dangerous
it into the
delay
port.
when the
The
symptoms
meter
are
is now
obvious
ready.
and the person is rapidly getting worse. Follow their personal diabetes treatment plan whenever one is available. For many people with diabetes who have a glucose reading below 70, the standard response is the 15-15 rule. Give
a small
15
sip.
grams of fast-acting carbohydrate,
There you go.
wait 15 minutes, then check the blood glucose again. If it is still below 70 or below the person's prescribed target, repeat the process. Continue until the glucose has returned to the target range and the symptoms are improving. Examples of approximately 15 grams of fast-acting carbohydrate may include glucose tablets according to the package instructions, glucose gel, about 4 ounces of fruit juice, or about 4 ounces of regular, not diet soda. Chocolate, cakes, and high-fat snacks are not ideal first treatments because fat can slow the absorption of sugar. Use a measured amount rather than encouraging the person to eat everything available. Once the glucose has returned to the target range, the person feels better, and they can swallow normally. They may need a balanced snack or meal containing carbohydrate and protein. Stay with them until they have clearly recovered. If their symptoms do not improve, return, or do not match the glucose reading, seek medical help. If the person is unconscious, having a seizure, not responding normally, or cannot swallow safely, treat the situation as an emergency. Do not put food, liquid, glucose gel, or candy into their mouth. Call emergency services immediately. If they are breathing normally, place them on their side in the recovery position and continue monitoring their breathing. If they are not breathing normally, begin CPR and follow the emergency dispatcher's instructions. Glucagon is an emergency medicine designed to raise blood glucose during severe hypoglycemia. If prescribed glucagon is available and you have been trained to use that specific device, administer it according to its instructions. Emergency services may still be needed, especially if glucagon is unavailable, the person does not recover promptly, or alcohol may be involved. Never delay the emergency call while searching for supplies. Never force an unresponsive or confused person to eat or drink. Never leave them alone and do not allow them to drive. Do not give insulin to treat suspected low blood sugar, and do not assume that improvement means the danger has completely passed. The cause still needs to be identified, especially after a severe or unexplained episode. To reduce future risk, take diabetes medication exactly as prescribed, avoid skipping meals, and plan for changes in exercise, travel, illness, or alcohol consumption. Carry a source of fast-acting carbohydrate and keep glucose monitoring equipment accessible. If glucagon has been prescribed, make sure family members, friends, or co-workers know where it is and how to use it. Wearing a medical identification bracelet may also help others recognize the emergency. Frequent lows, nighttime episodes, or reduced awareness of warning signs should be discussed with a diabetes healthcare team. Medication should never be adjusted without professional guidance. Recognizing low blood sugar early can prevent a minor warning from becoming a medical emergency. Share this video with someone who has diabetes or with someone who cares for them. Subscribe to Dr. Baro Body Signals and learn the signs before every second matters. This video is for general education only and does not replace individual medical advice or emergency training.